what is precocious puberty. So you see that they have early menstruation, they have early breast development, there's early ejaculation, deepening of voice, mood changes, early body and physical growth which is premature to the age. Now what are the consequences, or what are the symptoms for it? What This is very common, you can go to the literature and see, I'm not going to the details. But one more thing I'll tell you is, literature says कि in causes for early puberty, one of the most important causes milk and dairy products. So what they are saying nowadays कि if you have to avoid the menstrual complaints या पीसीओडी इतना राइज अप हुआ है या इतने सारे कंप्लेन्स राइज अप हुए, तो उसके पीछे का जो रीजन है वो मिल्क है या डेयरी प्रोडक्ट्स है, तो स्टॉप गिविंग डेयरी प्रोडक्ट्स. द रीजन बिहाइंड इज दे आर सेइंग कि जो ऑक्सीटोसिन या जो पिटोसिन का इंजेक्शन काउस को दिया जाता है या बफेलो को फॉर मिल्क, so that is one of the reason. But this is a half truth, I will say. One more reason which is very very important is, since I am somewhere connected to the cow industry, and not industry but पशु पालन में जो काव होती है उसको, तो रिसेंटली आई विजिटेड समवेयर एंड आई फाउंड आउट दैट जो अभी हाइब्रिड्स बन रहे हैं, जो काव के हाइब्रिड्स आ रहे हैं, तो आपको पता है कि जस्ट गोइंग ऑफ ट्रैक, आई नो आई एम गोइंग ऑफ ट्रैक बट इट विल मेक यू अंडरस्टैंड व्हाट आई एम ट्राइंग टू टीच यू टुडे, कि अभी जो न्यू जर्सी गाय जो आ रही है, तो उसके साथ एक कॉम्प्लिकेशन ये है कि यस, द प्रोडक्टिविटी इज ह्यूज एंड ट्रिमेंडस. वो 10 to 15 लीटर्स ऑफ मिल्क एक टाइम में देती है, ठीक है. लेकिन उसका सबसे बड़ा प्रॉब्लम ये है कि ये जो हाइब्रिड इन्होंने डेवलप किया है, उसके बाद जब वो लैक्टेशन चालू करती है या जब डिलीवर करती है, इमीडिएटली आफ्टर डिलीवरी द मदर rejects the baby, and this is the consequence, that there is no motherhood in that mother delivering that calf. And because of that जो दूध आ रहा है, आप ये सोचिए जो गाय अपनी बच्चे को होने के बाद ही रिजेक्ट कर दे. एंड व्हेन आई गॉट टू नो अबाउट दिस, आई स्टार्टेड वीपिंग ओवर देयर एंड आई हैड गूज बम्प्स, बिकॉज देर इज नो मदरहुड लेफ्ट. एंड इमेजिन if this milk is being drunk by us, there will be no motherhood left, क्योंकि जैसा खाएंगे अन्न वैसा होगा मन, जैसा पिएंगे पानी वैसा बोलेंगे वाणी. And this is very true. And the upbringing what we are giving to the child, because the mother immediately after the delivery is fighting for her own survival, is fighting for competing to the male world, wants to earn money for the livelihood, and somewhere leaves the child prematurely within 5 months, within 2 months, within 6 months upon the maids, and just leaves the child and goes to the world. आप ये इमेजिन करिए, अगर आपके बच्चे का पालन पोषण आपकी मेड कर रही है, तो what thoughts the child will get. तो whatever you are, since the 6 month you tell the child कि अरे ये जल्दी जल्दी ये 6 महीने निकल जाए, ये बच्चा बड़ा हो जाए और मैं बस घर के बाहर चले जाऊँ, एंड आई वांट फ्रीडम. सो दिस इज what thought process is going to the children growing up. So they want to grow fast, they are alone, they are insecure at home when mother is not there, when there is no predictive environment, they are left behind. हाँ, जहाँ दादा दादी हैं उनको प्यार करने वाला कोई है तो चीज़ें डिफरेंट है, बट जहाँ पे क्रचेस में भेज दिया, क्रश में भेज दिया, या प्ले स्कूल में भेज दिया अर्ली, या ऐसे एनवायरनमेंट में भेज दिया, या कोई मेड के भरोसे अपने बच्चे को रखा, तो उतना एनिमोसिटी है उस एनवायरनमेंट में कि दे डोंट फील प्रोटेक्टेड, एंड देयर ऑल्सो दे वांट टू ग्रो वेरी फास्ट. So they want to grow themselves very fast because they have that fear, और उनको लगता है बड़े होंगे तो जल्दी से हम इस घर से बाहर चले जाएंगे, जैसे ही हम बड़े होंगे तो हम लड़ पाएंगे, हम फाइट बैक कर पाएंगे. मैं छोटी हूँ ना, इसलिए मुझे घर पे रहना पड़ता है, मुझे जल्दी बड़ा होना है. So this is the intense desire this child will have, that I want to grow fast, and there is no love in this universe, so I don't want to be loved. I am someone who is not being loved, so I want to end my life very fast. Somewhere I want to finish this whole cycle of this femininity very fast, और जितना जल्दी जल्दी खत्म होगा उतना जल्दी जल्दी मेरे को मुक्ति मिलेगी. And therefore this early puberty has started. So the reasons for this early puberty in cases is going to be very deep rooted. Don't take just the rubrics like precocity or just the rubrics like early puberty in females, but go to the depth and see the emotional causes. Is there any rejection? Is there any forsaken feeling, hatred, animosity, or there is even overprotection is also one of the reason. Why overprotection? Because in overprotective environment also they don't have their own brains. They feel like they are under the control of someone else, and that control is so huge that they cannot even breathe. And because of that also they have that feeling of suffocation, and they develop such diseases, or insecurities develop, because again insecurity will give you psychosis, and this is the root cause where the sora shifts its gear from psychosis to syphilis and ends up into precocity in development. So this is the sole reason. And if we see at the level of physiology, so the main reason for precocious puberty is gonadotropin independent diseases, and there are causes which are gonadotropin dependent. So there is the primary reason is there a premature activation of the GnRH pulse generator, that in girls often no underlying cause, however always pathological in males. So they want to say that there are certain tumors or something like diseases where are in the congenital anomalies which can lead to precocious puberty, but these are the cases of rare cases. And again, but the most important thing is there is a premature activation of the gonadotropin releasing hormone and excessive production of androgen or estrogen, which is before the age of requirement. And as we all know that these hormones are responsible for activation and development of secondary sexual characters, and as we all know before the puberty they are insensitive, and but with puberty they are more into sexual growth. And you know that what male develop and what how female respond to these hormones. So these releasing hormone they start at the age of 8. So definitely this age of 8 is very important. And as we all know that my child which case has been presented to you all, she was already into the age of 9. So according to this age group, yes, there is stimulation which has started, but the whole journey and activation process takes time. This is something with the nature. The releasing hormones starts getting secreted and it attains the complete maturity by the age of 12 or 13 years. But imagine this girl child attained her menarche at 9 age. So this stimulation must have started when she was 5 or 6 years. अब आप ये सोचो, आई हैव अ चाइल्ड ऑफ सेरिब्रल palsy which who started menstruating at the age of 6 years, and she's mental retarded child. Continuously she's having her menses very regular from the age of 6 years. So these all factors are responsible for premature precocious menses or puberty. I had seen a child of 9 years with a complete developed penis like a male penis, and that was also a case of premature testis development, and he had some teratoma or brain tumor. And gradually that case I've just seen in OPD, so I have seen that case, I could remember. But these ovarian premature activation we are seeing many cases these days, and everyone is asking कि इतना precocity क्यों हो गया. And I talked to my mother, and to my mother's age they would say कि हम 14 साल and 15 years में हमारी menarche आती थी, and we used to play very easily on the roads, and we see that today's girl don't know anything and they have started their menses. And you all know the we can understand the pressure this child must be going after having early menses. And we all know that these yes, because the cycle is early, the hypothalamus and the pituitary axis, which works, functions very actively, and this results into the premature stimulation of gonadotropic releasing hormone, resulting into surge of LH and FS, which is very premature, and these children will definitely land up into infertility, or they will land up into future complications, again future complications of infertility. Because see, the quality, I will tell you, if you know any agriculture farms or something, you are associated with them, अगर बहुत जल्दी किसी फसल को काट दिया जाए या राइप हुए बिना उसको काटा जाए तो उसकी क्वालिटी नहीं रहेगी, उसका सीड ग्रो नहीं होगा, या उसके फ्रूट में वो टेस्ट नहीं रहेगा। आज की डेट में प्रोडक्टिविटी बहुत है बट टेस्ट नहीं है। सिमिलरली अगर ये प्रिकॉशियस प्रेगनेंसीज या प्रिकॉशियस प्यूबर्टीज आ रही है, तो इनको तो कुछ भी नॉलेज नहीं है, एंड टिल द टाइम दे विल अटेन देयर सेक्सुअल लाइफ और दे वांट टू कंसीव, their ovaries will go into premature ovarian failures, they will land up into premature menopause, and leading into increased cases of infertility. And again, because they don't have that feminine characters, they are not being brought up with that femininity part, and they don't love being a female, they will land up into more of testosterone, more levels of androgenoid hormones, more of cortisol level, increasing again the ratio of PCOD and infertility again. So this will give you again an understanding why PCOD has increased so tremendously. In every second female coming to your doorstep has got PCOD and infertility, which has increased. So this is the whole understanding of the complete context. A short and sweet, I think you have understood the message what I wanted to give. Any questions regarding this? If something is not being understood, anything not understood, please share your opinions, your views, or your observations in such cases. If you have observed in your practice, I would love to share. Then we'll go to the analysis because that is very short part. Are you all there?
Yes, ma'am.
Do you have any experiences regarding whatever, so that it will help others also? Today's my motive was not giving you a case, but my motive was sharing you the whole thought process, because precocious puberty is something which is coming up very tremendously, and being homeopaths, it is really coming to us every now and then.
Can I say something, ma'am?
Yeah, sure, I'm just waiting for people to share.
Uh, just few days back, I got a case of precocious puberty in a 7-year-old child. Like, mother came in asking for if we can help, and I was surprised at 7 years. And how can we say that this is puberty? Then she showed me the pictures of this secondary hair growth in his pubertic area, in his pubic area, as well as in his axilla. So I have told her to get the child once, and we will have the details he's seeking later. But I was really surprised that he's not even completed 7. And 3 years back, he had come to me for nocturnal aneurysms, which was very nicely treated. Like he was out of it within 2 months. So I'm waiting for the child to come back again.
Do you know
But I don't know
any
how
such
to.
background you have found such causes over there? Because these causes are multifactorial and not unilateral causes. So you will see. So you have to see the whole web, and you cannot see a pinpoint over here. You have to see the whole web, because that plays a very important role in developing the epigenetics and how it plays the role in developing the disease.
What I have realized is maybe the child is IVF case. The parents both are 45 now, but the child is hardly, he will be 7 in next 3 months. So maybe the multiple injections that came up during the treatment and test tube baby. So
Okay.
maybe she was on hormones all her 9 months. So
Barabar.
that could be one of the reasons.
Yes. So what's there in the mind now? See, a test tube baby is again a baby against the nature, right?
Right.
The parents
Yes.
had decided not to have the child. Now they are forcing to get a child through a test tube baby, which is again not a normal method of conception. And a test tube baby is again an artificial baby, right? And
Yes.
the children, the parents, see the insecurity what parents might have is they are already crossing the age of 45. So what instinct they will give to the child is ki, since we have crossed the age limit. See, a mother, a father who are parents at the age of 20s, है ना, early 20s, 24, 25, they know कि till the child goes to 18, 19, and when they have to, they need real support of parents for career settlement and everything, so they will be available for the child. But here in such cases where the parents are getting married very lately, and they are delivering the children after 35, till the time the children will get puberty, they will be already 60s age. So what instinct they are giving to the parents, since we are delivering you at a very elderly age and we are very adult, so this is not a parent and daughter relationship, that will be a parent and grandparent, a child and a grandparent like relationship. क्योंकि पहले के समय में क्या होता था, 45 की एज में तो बहू भी आ जाती थी, 18-19 में बच्चा होता था, दैट वाज अ कम्प्लीटली राइप यूट्रस एंड इजी कंसेप्शन, और फिर से 20 ईयर्स में बच्चे की शादी हो जाती थी और उनको भी बच्चा हो जाता था, है ना। तो बहुत सारी जनरेशन एक साथ रहती थी, और अगर 40s में आप बर्थ दे रहे हो, तो आप एक फिर से फियर और इनसिक्योरिटी के साथ बर्थ दे रहे हो कि हम आपका पालन पोषण कैसे कर पाएंगे, क्योंकि आपकी एज तक के तो हम बुढ़े हो जाएंगे, वी विल नीड सपोर्ट, तो फॉर आर सपोर्ट इफ वी आर गिविंग यू बर्थ, so please grow fast so that you can give us the support. So I think in your case you should explore this area, what expectations they have from this child, and why did they want a child so desperately, because they could have gone for the option of adoption also. Why didn't they go for adoption? Why IVF was again trial? Because at very elderly age they have gone for this trial.
Ma'am, actually they were trying from for almost 10 years, I suppose. She told me that they had 6 cycles of IVF, and the last one, which they, so if this is not working out, we will stop. And then they got positive. So they were trying since they were 30 to 33. After 10 years, they have succeeded having a kid. And the child is very, but he got good result with for nocturnal analysis with Parataka. So he is very, what we say, delayed milestones, very timid and shy child, and all the characteristics of Parataka.
That
Now
is,
he may have changed.
yeah, that
That
is
is
what I'm
something.
saying na, matlab they have
Huh.
brought a child without brains because they wanted a artificial developed child. They have developed an artificial child, just a robotic child, so they want the child to grow according to their wills. So head belongs to other can be a rubric for your patient. Just search for the whole history and do share this case with us so that others also have a great learning, because the more cases we'll explore, and I request to this group to make the WhatsApp group also active and share such sharings, because the learnings whatever you are getting through the lectures, and if you share it with others you will get more learnings and benefits out of it.
Sure, ma'am, sure. Share the case once he is here.
Sure. Any query? We'll go ahead later on. I want a great discussion today because I have been waiting for active participation from you all. Anyone else want to share something? Dr. Aarti, you have given a question over here. Yes, I have already told ki an overprotective environment will also give lot of insecurities, leading to psychosis again, and shifting to syphilis, because the fear of losing the loved ones, or the fear because of overprotective environment, the children are not being allowed to sustain or survive. मतलब आप यकीन नहीं करोगे, ओवर प्रोटेक्टिव एनवायरनमेंट का एक सिंपल सा एग्जांपल है कि बच्चे को ये भी नहीं पता है कि भूख क्या होती है, बिकॉज बिफोर द चाइल्ड फील्स हंग्री, द चाइल्ड इज गिवन द फूड. So in overprotective environment also there is a suffocative feeling, there is a feeling like they want freedom, they want to go out of this whole protectiveness, and they want to develop their own identity. तो अगर ओवर प्रोटेक्टिव एनवायरनमेंट है तो इक्वली आई वांट टू ग्रो फास्टर, क्योंकि मुझे ये पता है कि ये ओवर प्रोटेक्शन मेरा कट शॉर्ट तभी होगा जब मैं बड़ा हो जाऊंगा. अगर मैं जल्दी से बड़ा हो जाऊंगा तो मुझे अपने डिसीजंस लेने का अधिकार होगा, मैं अपने अपने हिसाब से जी सकूंगा, मैं अपने हिसाब से सारा चीज़ें कर सकूंगा. ओवर प्रोटेक्टिव एनवायरनमेंट इज मोर साइकोटिक एंड मोर सफोकेटिव ऑल्सो. आई हैव शेयर्ड व्हेन आई वाज शेयरिंग द केसेस ऑफ एडिनॉइड्स एंड डीएनएस इन माय स्कूल विजिट्स. आई हैव फाउंड कि जो स्कूल मीडियम से लोअर क्लास की थी वहाँ पर मुझे एडिनॉइड्स के केसेस बहुत कम मिले. वहाँ पे मुझे थोड़े बहुत अपर रेस्पिरेटरी डिजीजेस मिले, एलर्जिक राइनाइटिस या मोर ऑफ स्किन कंप्लेंट्स देखने मिली. पर लेकिन जहाँ पे हाई सोसाइटी के स्कूल्स थे, जो प्ले स्कूल्स जहाँ पे बहुत ज़्यादा सोफिस्टिकेटेड लोगों को बिलोंग करते थे, वहाँ पे मुझे केसेस ऑफ एडिनॉइड ज़्यादा मिले, क्योंकि वो ओवर प्रोटेक्टिव एनवायरनमेंट था. और वो ओवर प्रोटेक्टिव एनवायरनमेंट फॉर चिल्ड्रन इज़ ऑल्सो मोर पॉइजनस, क्योंकि आप देखोगे कि जितना हाई सोसाइटी है उनके बच्चों का पालन पोषण पेरेंट्स नहीं कर रहे, उनके बच्चों का पालन पोषण मेड्स कर रही है, उनके बच्चों का पालन पोषण कोई और एक ऐसा नर्सिंग स्टाफ कर रहा है शायद जिसके अंदर वो मैटरनल फीलिंग ही ना हो. तो दैट लैक ऑफ लव एंड प्रोटेक्शन इज ऑल्सो देयर. So overprotective environment doesn't mean giving luxury and facility is equal to love, but love is love. In such high societies, parents are not actually available for the children to love and give them that help. I hope, Aarti ma'am, you got your point. So coming back to the case, anyone wants to share their experiences, or shall we move ahead? I'll come to that milk option. See, if you are able to get a milk from a resource which is easily available to your doorstep, they are not giving injectables, and the milk has to be from that pure form and not from that breeded cow. And as we have gone for organic food, we have to go for organic milk too. And also one more thing, the concept of vegan is based upon this only because the animal who is being brought up in this environment, the animal which is being not tortured, that milk can be consumed by us. Previously what used to happen is ki every person or every family used to have one cow at their own home or at their own shelter, and that cow used to be bring up by them, and they used to consume that cow's milk, and that extra milk would be shared by others, and they would not snatch the calf from the mother or something like that. Even we go to a vendor where nearby, where we go with our own bucket with our own things, and we see to it that he is not putting oxytocin injections to the cow. And there are other options like soya milk available, almond is also one of the option, and even peanut is also an upcoming option for milk and dairy products. And you must all have seen that those people who are suffering from PCOD, many of the dietitians are advising them to quit dairy products. So the main reason is because of this impurity of the dairy product. Rest nothing, but as we are student of predictive, we should know that the core or the core of the whole disease is these are the external factors, but internal factors play a very important role. The emotions what we share, being parents, being sister, being daughter, is more of love. So loving self and loving giving love to others is the basic concept, so that we can protect everyone from this environment. So let's go to the again let's go to the case. So any interpretations you would like to share? So here I think I have made myself clear the role of epigenetics, and the way how this whole consequence of the emotions, the mind, the psycho-neuro-humoral cycle, that is the effect of psych uh, upon your neurons, the how this is being perceived by your senses, how it is being converted through your RNA, how it is being seen, perceived by your nucleus, and it is being generated again back. So that is psycho neuro humoral cycle. So cause effect relationship, the emotional pathology. So now stop asking anyone for a single emotional pathology, go beyond these books, because these books are just talking about some factors which are responsible, but they are not talking about totality, because every disease is a consequence of multiple factors, and every tissue of your body has got its own sensitivity, every tissue has got its own identity. So in this case, as we all know, this is a case of puberty, where it is not only ovarian stimulus but the hypothalamus pituitary axis, which is releasing the gonadotropin releasing hormone very prematurely. So there has to be some consequences with the identity part. So there will be rubrics which will play a role with the identity also, because this is a basic identity, a basic survival of the individual. So a very easy case to analyze. So please come up with your totality. Now I'll next move to the other things then. Anyone finalize the totality? Let's be interactive. I enjoy interactive sessions. Yes, the perfect rubric. Yes, Nisha ma'am, that is the perfect rubric. Time passes too slowly because they have to run very fast. And yes, that is what I have also considered. I have considered many basic things in this case. Remedy must be out for everyone. You all know that this child, what are the rubrics, basic understanding of the child. This is a rubric for entry point. Definitely there is animosity, cruelty, precocious puberty, delusion, time passes slowly, capriciousness is there. Definitely go for the basic constitutional understanding. She's what kind of personality? She has jealousy, yes. The core is jealousy. There is competition. More beyond jealousy, I will tell you in this case that there is a competition for the survival. There is a competition for the own existence with other uh, family members. Non-diligent, non-conscientious, yes. She is obstinate, contemptuous, jealousy, extrovert, talkative, loquacious, restless, hard on inferior. Yes, but she's equally obstinate and contemptuous for Dadi also. So I will not only stuck up with hard on inferior and soft on superior, but she is definitely insolent with everyone. She's obstinate, talkative. Yes. See, now when you are understanding this mind, I wanted to take few more rubrics about this case. Is more on the understanding. Is just okay, this is there, matlab she is talkative, she is like that, but what you have to broaden your concept or your own thought process. while this case is being unlocked. I don't want you to summarize to few rubrics, but think beyond the process and think what existence problem people face, what identity problem people face, and how you will go through these cases and what kind of rubrics you can pick up, because such cases will come up, but you will not end up with single rubric like time passes too slowly is not the only rubric, but there are other rubrics too which you need to think about. So there are rubrics like head belongs to other, shoulder, delusion, confusion, confounding, definitely confusion of identity. I'll go ahead. So there is adverse family situation over here. There is sibling jealousy, so there is a tough competition and a fight. There are family conflicts, comparison which is there, attention which she wants, and she wants freedom, and therefore because of all this she wants to grow faster and earn money, she wants more luxury, she doesn't like her own childhood, and which is the gross sora, because she has got aversion to herself somewhere. If you go deep down you will understand that she has developed a hatred. Before hating others there is a hatred for self. She's saying मैं गंदी हूँ, मैं पढ़ती नहीं हूँ, मैं खुद ही इतनी गंदी हूँ तो मैं दूसरों को क्या करूँगी. Everywhere she is accepting it, and she is telling the truth very plainly. So such rubrics will also come up. She is hating herself at the core level, and if I hate myself at the core level, when you deal with these cases, ask the patient to start loving themselves. If they start loving themselves, then they will find love with others, and definitely the clock will get reversed, and प्यार हर किसी को चेंज कर सकता है. This is what I have learned through all these cases in PCOD. Everything in all these cases where there is identity problem, you can also think that this confusion of identity existence is a problem. So all identity rubrics can also come up over here. So contradiction intolerant, she's aggressive, she's abusive, she's dominating, she's angry, there is financial stress, want to earn money, independent, that is luxury, frustration, there is obstinacy. Oh god. So there is extroverted, loquacious. So there is contradiction intolerant, aggressiveness, abusive language, dominating, anger, financial stress, want to earn money, frustration, obstinate, insolent behavior, argumentative, story writing, non-conscientious, non-diligent behavior. Uh, the other rubrics, the talk what she has, the speech what she has, can be interpreted as extrovert, loquacious, meddlesome is poking nose in between when two people are talking. Presumptuousness, again a contemptuous and insolent behavior, a rude behavior. There is impertinence, that is insolency. There is audacity, because she has got no fear. She's contemptuous, she's defiant, she has no reverence for the seniors. She has got a revengeful attitude, quarrelsome behavior, disposition to contradict, and a disposition to revenge from others. So she has again a conflict. What you can see over here, this defines her own personality, her whole constitution. So we all know that why she wants to grow fast is because she wants to finish her whole lifespan very early, because this is what stimulus the mother has given to this child, that there is no good nature or environment in this world for you, and if you have to live in this world you have to really end your life faster. And this, because you are born as a female child, the environment will just kill you, it is really poison for you. So here you can take delusion poison also. Delusion injury will receive. So the rubrics which are coming up, there is some problem. नहीं आ रहा है क्या नेक्स्ट स्लाइड? ये है ना. ठीक है. So you can see the rubrics like delusion, time passes slowly, grow faster, confusion, identity, delusion, delusion, head belongs to other, uh, then confusion of identity is there. I'm not here telling you कि you just focus on one rubric, but yes, delusion of being poisoned can be there, delusion injury will receive. So every case will have a broad spectrum. Don't only stick up to few things, but see the case in a complete greater perspective. Because in this case, I have seen the remedies which were coming for time passes too slowly. I already took yeah, I already took this rubric that she wants to grow faster because she feels that the time is passing slowly and therefore the body wants to finish it off very fast. But here I understood that here she is fighting, the main sole cause was fighting for her identity for male versus female. What a seed was given to the mother by the mother was for femininity, for male. So there was an identity crisis. Rather than going to the rubric of delusion, time passes slowly, I will go for confusion identity. In this case, yes, errors of personal identity is a very different rubric. Here I will take is confusion identity more appropriate, because errors of personality identity is like in personality disorder where they don't understand, like schizophrenic, like bulbulaya, that was error of personality. Because after growing she got confused कि मैं मंजुलिका हूँ कि मैं विद्या बालन हूँ. So that was some history in that. So there you can take errors of personality, but here I have taken more appropriate, I found, was confusion of identity in this case. Yes, there will be more delusions regarding the identity if you see, where the existence is important, because here during the pregnancy time existence was very important, and that existence was with the sexual identity that it has to be a male, it has to be a male, it has to be a male. So there is identity crisis, and there is hatred for self, anger for himself, lack of love, or love sick. They are people who are love sick. They are, she's not fighting because she wants attention, she wants everyone's love and acceptance. And she feels that she's being hated by everyone, she feels that she's ugly, delusion ugly. So there will be certain rubrics like this which will really guide you for such cases. I'm not taking a single rubric because my motive is to give you the whole process what sir has taught us. So can anyone else come up with more rubrics of identity, more rubrics of identity? Anyone who has studied syphilitic rubric? There is a rubric of confounding. There is a rubric in confounding. There is a rubric called as mistakes makes time in, confounds future with past. You will understand this rubric. And there is again makes mistakes, same rubric, where there is confounds and there is confusion, where the person mixes, it is not only with the past but confounds present with the future. Can you understand whole evolution over here? What she's saying is she's not living in today, she's living in tomorrow, that I want to grow very fast and I want to earn money, I want to grow uh, money. And there is also a rubric of fancies exaltation. This is also a rubric which you can consider in these cases, because they are in that fanciful world where they have built up the castle, that they are very grown up, they are enlarged, their body is enlarged, the body is growing into that delusion of enlarged, delusion of large. And because of this thought process is there, that they feel that they are grown up, they are large, they attain that precocity because they are growing up. Yes, antagonism with self, great. Again, go with other rubrics. I want you all to participate now. This is a brain teaser. Confusion identity to his sexual. There is a rubric. See, I have not written the rubrics. I am just giving you the process so that even your brain also start teasing. There is self contradiction. There is aversion, misanthropy. There is a rubric called as misanthropy, where they don't like the human. They are, because of the animosity, they start hating the क्या बोलेंगे, human race है ना, human race they start hating. Because of this hatred, because of this misanthropy, there is a rubric as death desire. They want to die because they want that they should complete this whole cycle. Hatred, persons of sex to opposite. This girl child who has really developed so much of animosity because she's a female child, when she grows up, do you imagine the kind of animosity she might have for the male counterpart? She might also think that all males are like this, or she might go into homosexuality or heterosexuality. That is a different part, definitely, but she will have a sexual precocity also. There is a rubric hatred, uh, women of, then moral feeling want of, because of this all hatred, and whatever antisocial behavior which is there, she will have that moral feelings, because she won't have that moral feelings. अभी वो ruthless हो जाएंगे because of all this. जिसको प्यार ही नहीं मिला, वो क्या किसी को प्यार देगा? So this is all the animal characters which a person will develop because of these reactions. Yes, moral feeling, want of, sensitivity, want of is something related to hard-heartedness. There is a rubric of sensitivity, want of, which is related very close to hard-heartedness. Get more. So this way, I will tell you कि you can list down all the rubrics which are close to the identity, which define someone as an identity, and what consequences can come up. Think in a multi directional way, and give a thought कि what can give to what reason, and in our cases, what is the sole cause for it. Just not labeling it to certain particular thing, but just give it a full context. You will get more broader aspect and a broader view. So this was the rubric. I will say ki precocity was just taken up, but yes, the remedy went was lachesis. I have taken as contradiction disposition, because that was her soul, because her whole soul was to contradict. This was what mother has given to her, that you have to contradict everyone, then only you can survive. And confusion, identity, and precocity, when combined, came up lachesis. There, when I saw time passes too slowly, there lachesis is not there, but cannabis indica, medorinum are there. And in these cases of precocious puberty, such nozodes do come up. So I hope the message what I wanted to convey to you all was any other thing. Any doubts? Yes, lachesis, when I went into details, yes, it covers everything. It covers contemptuous behavior, it covers revengefulness, the jealousy, the thing that I am the ruler, I don't want anyone into the kingdom. Lack can also comes up, but lack can will have certain mild and timidity, but she is really not like that. Somewhere she is manipulative, she's flattery, she's flattering her children, her teachers. The way she's been behaving is really very different. She's behaving in a very different way. And true heartedly, she's different personality, and whatever showing to the world is different. And yes, this is lachesis was given, and only one dose has been given, and after that no dose is required. In spite of so many changes in weather and everything, no episodes of breathlessness, no asthma has come up. Her menses, which used to be slightly painful, 200 has been only given to her. Single dose has been given, and no repetition has been done till now. And after that there are no complaints. In fact, she's able to enjoy everything. Now I'm trying to improve her relationship with her grandmother, and at least now she sits quietly without poking her nose. And somewhere I think she will understand the pain of grandmother, because everything is being feeded to the child from the eye and perception of the mother, rather than her own perception. So if she develops as gradually, she will understand. Yes, hyosamus is also there, but I did not find the characters of a drug remedy over here. It was more of an animal kingdom, and this was more of an animal characters which were coming up. So I gave her lachesis. Drug remedies will also come up in these group, because they are also tough fighters, and they are also tough remedies. So, my message today was to make you feel and understand the materia medica aspect, ki how a personality and the constitution develop, and how the adverse environmental situation plays a role in developing this constitution over a period of time. And the whole personality changes, and how the remedies beautifully shape up. You don't have to fit into the remedies, they really pop up from the repertorial totality, and the rubrics do come up. You just have to keep your eyes open, your sharp senses, and your interpretation should not be on the superficial level. If someone takes up over here, like menses appear early in this case, they will land up into giving phosphorus to the remedy, or remedies like very deep, very superficial, some plant remedy like pulsatilla or something like that, and they will really land up into suppression. Because these rubrics have to be understood at the core level, and this is what sir has taught to us very beautifully. I'll just see.
Ma'am, can I share one case?
Yeah, sure, I am eagerly waiting for people to share.
Yeah, ma'am, I was having mother. I'm So
Please be
mother is
louder.
having
Your voice
psychiatric.
is little bit mild, Hitul.
Yeah, mother and can you hear me now?
Yeah.
The 28-year girl, she is a case of amenorrhea for months together, like 8, 10 months. She doesn't get her menses and all. And her mother is also my patient, and she has been referred to psychiatrist because I was not able to help her out with her problems. So the daughter is having amenorrhea, and mother doesn't allow daughter to get married also, and she's so frustrated with mother because mother is having some psychiatric issue like schizophrenia kind of. She hears the noises continuously from outside or like in her house also she will see people are talking to her. She continuously hears people are giving her bad words and they are talking to her and continuously goes into her mind. Even she will not be able to cook food and all. कि पानी में से इसको आवाज आएगी and all. Some noises are continuously coming because they doesn't.
Right. See, I have taken and discussed PCOD before. Voice. So in PCOD also I have taken before that PCOD cases also we have seen the conflicts like this ki when the mother is allowing or when there is a conflict at the maternal end or when the mother is a complication, so definitely the identity problems come up, and here she is going into early menopause, and they are going, these females, because I've seen cases of PCOD where they are not menstruating for 1 year, 2 years, or they have not even responded to the stimulation done by the OC pills and all. So they are the cases which are going into early menopause. So therefore there are, again I will tell you, there is an identity problem. They are fighting with their own identity because they are fighting because they feel that their existence is not important, and as a female they are not playing a proper role, and since here the mother is not well, so she might take up the responsibility of mother and she
Yeah,
wanted to
yeah.
play like a male. So you go for identity rubric. In such cases you will see wonderful results. And regarding mother, I will say that again, listening to the voices and all are the pathological symptoms of schizophrenia, and they are the rubrics related to the disease. And if something is very pqrs and predominant, only then you can take such cases or such rubrics.
Yeah, yeah. Daughter is also earning and running the house
Yeah,
and
that is
all.
what, that is
Yeah,
what.
so that's what you are right. I have taken all this rubric also, ma'am. So many remedies since 2 years I am trying.
Think of
But
potency and repetition, because I have observed recently. Before I used to go with only single doses, but I have gone through the literature, through the posology explained by Hahnemann sir, and the millisimal scale or the centesimal scale, what he has described. Water dilutions and repetition of doses has worked wonders to me, and I have started giving them, and I'm finding better results with them with no aggravation. So you need to think over and think about the posology, and if your remedy is right, then increase the potency and see the results. Even you can go for 0 by 1.
Okay, 0 by 1, ma'am. How do you make it? Actually, I don't know about this. NM water disease.
Okay, 0 by 1 is to be given and dispensed in water doses, and succussion method, what we say, and you have to take 100 ml bottle and add a few globules to it. That is one part of medicine and 90 part of water, or distilled water, what we prefer. And we have to just give 10 strokes before the dose is given. So if you have started by 200, example I'm taking 200, so when you give 10 strokes it becomes 201, again 10 stroke it becomes 202.
Achha. So
And even
repetition
second
means
dilution works
200
well.
maybe
Hmm?
0 by 1 and all.
Yeah, recently
It is not only 10
I
ml.
experimented with a case of herpes zoster, and the case was like a very bad case. I can present that case. It's a very beautiful case. And before I went with certain remedy which was very superficial, then I understood ki no, this is an aggravation and this has gone to very deeper tissues. So remedy was wrong. So I prescribed in the second dilution, and I have found that the patient has come out even without any painkiller.
So ma'am, in 200, 1 ml, in everything we can use
Yeah,
this.
yeah, yeah.
It is not
I
only for
experimented with 200 also in dilution doses. That has worked. When I feel that there
Achha.
might be an aggravation coming up, so I ask for dilution, and I ask for repetition also with the dilution. And the strokes has to be done properly. It has to be taken care in dispensing because वो important है.
Ma'am, these dilutions can be repeated daily basis or only once in a
Depend
week
upon the
or
case.
once
I
in a month?
see posology is something depending on the cases. It is not a general thing which I can say, but yes, if need comes, they can be repeated even every hour, every minute. That is what Hahnemann has written also.
Okay, ma'am. Okay, thank you so much.
Thank you. I hope you all enjoyed today the knowledge what I've shared, and this is a very deep rooted knowledge, and this needs a complete case understanding of each and every case coming to your doorstep. Without a complete history, you will never understand what I'm trying to say. And as Hahnemann said, कि whatever literature I'm writing in Organon today will be half understood by my student today, but tomorrow they will understand in totality. Similarly, I feel sometimes that whatever I'm teaching from this desk, it is not me who is delivering, it is the divine powers who are delivering. And it might be half understood today, but if you really work hard at your clinics, you will understand it incompletely, and every case will teach you, and every day you will grow. So these are the words from sir which are coming up, I should say. And we are real mere particles in this whole universe to do something. This is God's job, this is universe work what we are doing, and homeopathy is divine. And yes, definitely we are a part of that divine plan, that we have been brought up and born as homeopaths. Thank you. Thank you for joining homeopathy. And please take this ahead, take this learning ahead, and keep learning and keep growing. Thank you.